We all know that feeling, don't we? That little lift you get when your pet, greets you at the door. Or just having them nearby, that quiet comfort. Most of us feel kind of instinctively that our pets bring a lot of joy.
Yeah.
But beyond that warm feeling, what does the actual science say? Are there real measurable health benefits? Today, we're doing a deep dive. We've looked at a big scientific review on pet ownership.
Oh.
Our mission: to pull out the key stuff, the most important findings, and give you a shortcut to understanding this whole pet effect. We'll touch on mental health, physical health, and even how pets help specific groups of people. You might have a few aha moments. Okay, so let's start with mental health. It seems kind of obvious, right? The unconditional love, not being judged. But you're saying the research goes deeper than just, feeling good. What's happening physiologically?
Oh, absolutely. It's fascinating, actually. The research shows pretty clearly that interacting with animals, just petting a dog or cat, can measurably lower cortisol levels. That's your main stress hormone. And it lowers blood pressure, too. There is this classic study where people had to do a stressful task. When their pet was in the room, their heart rate and blood pressure were significantly lower compared to when, say, a spouse or a friend was there instead, without the pet.
Wow, so the pet specifically was the key factor.
It really suggests pets act as this unique kind of stress buffer. And it's not just dogs and cats. Even petting something like a rabbit or a turtle has shown anxiety reduction.
A turtle. Interesting.
Yeah. And even just watching fish swim, that's linked to feeling calmer, small drops in heart rate and blood pressure. And looking bigger picture, one study found that people under a lot of stress who had pets actually made fewer trips to the doctor over a year compared to stressed people without pets.
That's pretty compelling for stress. But what about that sense of purpose people talk about? Does the science back that up too?
It really does. Pet owners consistently report, higher life satisfaction, fewer symptoms of depression. And the thinking is it's partly the act of caring for the animal and also receiving that affection back. It gives you purpose, it gives you routine, and those two things, they're really strong protective factors against depression.
That makes sense.
We even see it in practice, like animal-assisted therapy in nursing homes. Regular visits from therapy dogs have clearly improved mood in residents dealing with depression. And it's not just dogs, I read, about pet birds boosting morale, giving people someone to talk to.
It feels like connection is a big theme here, especially now when people can feel quite isolated. How do pets fit into that?
Well, they offer direct companionship, first off. That clearly helps with feelings of loneliness. Lots of studies link pet ownership to lower loneliness scores. This was especially noticeable during the pandemic lockdowns. Pets were vital companions then.
I bet.
But they also help us connect with other people. They're social facilitators. You see it all the time with dog walkers, right? They strike up more conversations with strangers. One UK study specifically mentioned the dog acting as an icebreaker.
Yeah, you always end up talking about the dog.
Oh, exactly. And think about older adults, maybe someone widowed or living alone. Pets can fill a really important gap in social support. Surveys show something like 80%, maybe more, of pet owners see their pet as a close companion.
Okay, so the mental and social side is strong. Let's pivot to physical health. We might think, okay, pets mean more walks, but it sounds like the benefits are broader than just getting some exercise, especially for the heart.
Yes, definitely. The cardiovascular link is one of the most researched areas. The American Heart Association actually put out a statement saying pet ownership, especially dog ownership, is, and I quote, probably associated with decreased cardiovascular risk.
Probably associated. That sounds cautious, but significant coming from them.
It is. And consider this. A huge meta-analysis looking at almost 4 million people across 10 studies. It found dog owners had a 24% lower risk of dying from any cause and a 31% lower risk of dying from cardiovascular causes.
31%, that's massive.
It's a huge number. And there's older research, too, a classic study, actually, showing heart attack patients who own pets had a significantly higher survival rate 1 year later. And that was independent of how severe the heart attack was. Not having a pet was actually a predictor of mortality.
Wow.
The thinking is it's a combination of things. Less stress, maybe less depression, and yeah, definitely more physical activity.
Right, you mentioned dog owners specifically.
Yeah.
How much more active are we talking? Is it enough to really move the needle on fitness?
Oh, for sure. That AHA review found dog owners are over 50%, 54% to be exact, more likely to get the recommended amount of physical activity, mostly walking. Studies from places like Japan and Canada clocked dog owners walking, on average, an extra 20 to 30 minutes a day.
Okay, that adds up.
Absolutely. And that translates into things we can measure like lower BMI, fewer signs of frailty in older adults. It helps with daily activities. Just the responsibility of having to take the dog out, it gets you moving consistently.
So beyond the heart and just general activity, what about other markers like blood pressure day to day or cholesterol?
Yeah, the CDC, the Centers for Disease Control, points out that pet owners often show lower baseline blood pressure, lower triglycerides, and lower cholesterol levels.
Okay.
But here's something really surprising. One trial, it was with hypertensive stockbrokers, a pretty stressed group. It found that owning a pet actually blunted the rise in their blood pressure during mental stress better than their blood pressure medication alone did.
Seriously.
No.
Better than the meds.
In that specific stress response context, yes, it suggests this unique physiological effect. And we also see benefits in recovery. Hospital patients involved in animal-assisted therapy report feeling less pain, less anxiety. They might even need less pain medication after surgery.
Okay, this next one always kind of blows my mind. The idea that pets might actually help train our immune systems. How could that possibly work?
Right? It sounds counterintuitive, doesn't it? It connects to the hygiene hypothesis.
Oh.
The basic idea is that being exposed to pets early in life, especially dogs and cats, might actually lower the risk of developing allergies and asthma later on.
So, like, getting exposed to more germs is actually good?
In a way, yes. An NIH-funded study tracked kids from infancy. Those with a dog at home had significantly lower levels of IgE by age 1. IgE is the antibody involved in allergic reactions, and that protective effect lasted into later childhood.
Ah.
Well, dogs especially, they go outside, they bring back a diverse range of microbes. Exposure to this diversity might kind of educate the infant's developing immune system, make it less reactive. One study even found infants living with dogs were 90% less likely to develop food allergies. And if the family had 2 or more dogs, none of the babies developed food allergies in that study group.
90%.
Wow.
Wow. That's really something. Okay, so we've seen these broad benefits, but the research also highlighted some really specific, almost tailored advantages for certain groups. Let's talk about kids and teenagers first.
Yeah, for kids, pets seem to foster things like empathy, responsibility, learning to care for something else, even self-esteem.
Makes sense.
And there are targeted benefits, too. For kids with ADHD, therapy dogs helped improve social skills, cooperation, even focus while reading aloud, more so than reading to, say, a stuffed animal. And for children on the autism spectrum, ASD, bringing guinea pigs into a classroom setting led to significantly less anxiety, more social interaction, more smiling and laughing. The animals can be calming focal points, and they act as sort of social bridges to interact with others.
Little furry diplomats?
Kind of. And pets also get kids moving and can even teach self-care. There was one study, I thought this was clever, where teens caring for a pet fish actually got better at checking their own blood sugar levels for their diabetes management.
That's a neat connection. Okay, what about older adults? You mentioned loneliness earlier, but what else?
For seniors, pets can be a real lifeline. We already touched on lower loneliness. An AARP survey found huge majorities felt loved and needed by their pet. That sense of purpose is key.
Right, feeling needed.
Pets also provide structure, routine. That's important for cognitive health, fighting off that feeling of aimlessness some experience after retirement. We see animal therapy boosting mood and cognitive function in nursing homes, and some observational studies even hint that dog ownership might delay dementia onset, possibly through that mix of physical activity and mental engagement.
Interesting.
And physically, older dog owners walk more about 22 extra minutes a day and show better lower body strength. One study looking at Medicare patients found seniors with pets actually went to the doctor less often.
Fewer doctor visits. That's a tangible outcome. Now, for people with disabilities, service animals are obviously crucial, but the benefits go beyond just the tasks they perform, right?
Absolutely. Guide dogs, hearing dogs, mobility assistance dogs, they provide essential functional help, of course. But the research really emphasizes the psychosocial benefits. People who get service dogs consistently score higher on measures of well-being, social functioning, engagement in work or school, compared to similar people still on the waiting list.
So it improves quality of life significantly.
Yes. Handlers report feeling safer, more confident, more capable. And we're seeing promise with psychiatric service dogs, too, particularly for veterans with PTSD. They seem to help reduce hypervigilance, panic attacks, even nightmares. The most common benefit veterans mentioned was just feeling calmer. More broadly, for anyone dealing with a disability, pets can combat isolation and stigma. They offer that unconditional love and a sense of normalcy that can be incredibly powerful.
And finally, what about people managing long-term chronic illnesses.
Pets offer profound support there too. For patients going through tough treatments like cancer or dialysis, having a pet is linked to lower stress, better quality of life. We saw earlier that HIV/AIDS patients with pets were less likely to experience clinical depression.
Right.
And there are hints of better physical outcomes too, like the heart attack survivors living longer. For people with chronic mental illness, pets can be uniquely supportive. A big review found pets provide, a reason to keep going. They reduce anxiety. They help people cope during crises. Many patients actually include their pets as part of their core support network.
Like family.
Exactly. And for some, tragically, the thought of who would care for my pet is actually a factor that prevents suicidal thoughts. It's that profound.
That really underscores the depth of the connection. Okay, so we've heard about all these incredible benefits across the board, which brings up the big question. Does it matter what kind of pet you have? Do we all need a golden retriever to get these perks?
No, not necessarily. That's a great question, and the research suggests it's really about the match between the person and the pet. Depends on your needs, your lifestyle, your living situation.
Okay.
So dogs, as we've discussed, tend to offer the broadest range, big boosts in physical activity, heart health, social connection, strong emotional support.
Right. The all-rounders.
Kind of. Cats offer really strong mental and social benefits, companionship, stress relief, mood boosts, maybe some heart benefits. The evidence is a mix there, but less demand for physical activity, obviously.
Good for apartment dwellers, maybe.
Potentially, yes.
Yeah.
Birds. Watching them can be calming, lower stress.
Right.
They offer companionship, someone to talk to, which can boost morale. Fish tanks, that aquarium therapy idea, are linked to calm, lower heart rate, better mood, and they're very low-maintenance companions. Small mammals, rabbits, guinea pigs, petting them reduces anxiety. They're great for kids' development, good companions for smaller spaces, even reptiles, like turtles. Surprisingly calming to interact with, plus they're hypoallergenic, offers a unique kind of engagement.
So it really is about finding the right fit for you.
Exactly. It's not one size fits all.
Okay, so wrapping this up, it seems clear the pet effect is real. It's multifaceted, hitting our mental, physical, and social health. The science really does back up the idea that pets are, well, profoundly good for most people. Obviously, it's not always easy. Pets are a responsibility, sometimes a burden. But it sounds like for most people, the positives really do win out.
That's a fair summary. And it echoes what researchers like Dr. Leila Esposito from the NIH say. She basically said, look, if your goal is getting more active, a dog might be great. If it's stress reduction, maybe watching fish is perfect. There isn't one single type of pet that's best for everyone. The key is choosing one that fits your life. When you get that match right, everybody benefits, human and animal.
That's a great way to put it. Ultimately, this connection we have with animals, it's just a powerful reminder, isn't it? That caring for another being, and importantly being cared for in return, it's just fundamental to our well-being as humans. It really confirms what so many pet lovers already knew deep down. Our furry or feathered or, even scaly friends, they genuinely make our lives better and healthier. Definitely gives you something to think about, the unique role these animals play, not just as pets, but as real contributors to our health.